This video shows how to prepare respiratory swab samples for use in a FLASH VetID test. Before you begin, make sure your FLASH VetID test is intended for respiratory swab samples. You can find the compatible tests on the front page of the instructions of use. To begin, put on gloves and place all required components on a clean, flat surface. For respiratory samples, you'll need 3 provided sterile swabs, 1 sample tube with the dropper cap, and a bag A containing the sample direct cartridge and the plunger. Flick the sample tube with the dropper cap to move all the liquid to the bottom of the tube and remove the cap. Collect 1 oropharyngeal swab sample and squeeze and swirl the swab in the sample tube for 10 seconds. Repeat this operation with a nasal swab and a conjunctival swab sample, and recap the sample tube. Finally, open the bag A. Take out the sample direct cartridge and pour all the contents from the sample tube into the cartridge. If you are running multiple FLASH VetID tests for the same patient at once, collect the samples from the 3 sites only once and use 1 sample tube. You do not need a separate sample tube for each test. As each VetID test requires its own sample direct cartridge, simply split the volume of the sample tube, depending on the number of tests run on the same patient. For instance, if you will run 2 different VetID tests, you will need 2 bags A and to add 12 drops from the sample tube to each of the sample direct cartridges. If you run 3 tests, add 8 drops of the prepared sample into each sample direct cartridge, 6 drops for 4 tests, and 5 drops if you are testing 5 items. Your samples are now ready. Proceed to the next video for instructions on how to run a test.